Here if I don't mute myself.
You have a dog too. The only thing I worry about in these meetings are the dogs barking when the post person comes and they show out. I don't know
All
what
right, you're
it
good to
is.
start.
All right. Okay, so we want to welcome everyone to our meeting of the Detention Facility Oversight Board. We'll call the meeting to order and we will call the roll Secretary Walker.
Slow tonight. I'm here.
Member Don.
Present.
Member Lawson, we did receive his letter of resignation effective January 13th. Board Member Lewis Walls. And Pam, at some point, if you'll try to reach out to her, I know sometimes she has a hard time getting on. Board member.
I sent her the link just a second ago.
Okay. Board Member Gay.
Present.
Board Member Harper.
Present.
We have a quorum. If you would take a moment and look at the agenda, I know it's been sent out in advance, but if you'll just take a moment to review it. And is there a motion to accept the agenda?
So moved.
It's been moved by Secretary Walker. Is there a seconder?
Second.
Second by Member Don. All in favor of the agenda, please indicate by saying aye.
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 Any contrary minded, motion carries. My report, I'm going to yield my report. I don't have a whole lot of stuff to say. I know we did receive a letter from the Director of Public Safety. I believe all the board members received it regarding a pending meeting and tour at the Justice Center. I think some of the board members have responded. My understanding is that he is waiting to hear back from all of the attorneys that represent the members of the dorm reps. I don't know if he has heard from everyone yet. I haven't responded yet. I'm waiting to see if we're in fact going to have a meeting before I respond, because I don't want to commit myself to a date and it doesn't happen. And for me, I'm less interested in a tour and more interested in actually meeting with the dorm reps. I do intend, I'll let the board know, I do intend to ask the director if they would make available the policy that dictates that we can only meet with dorm reps with the approval and in the presence of their attorneys. I know that it's been stated, but I just want to inform the board that I will be sending a correspondence to the director asking if we could get a copy of that policy in writing, so that we'll know if this is a policy or a standard operation procedure, just exactly what it is. And so the other thing that I mentioned also, we did receive the resignation of board member Lawson. Tom's been on the board for 3 years. He was just recently reappointed. He made a huge contribution to this board. We really are grateful for the service that he provided, for the somberness and for the intellect and for the commitment that he provided. And I know some of the board members who knew him have already responded. He will definitely be missed. And so what that means at this point, we are 3 board members short of our complement of 9. As I've said in the past, the thing that concerns me about that is I'm hoping that the administration will move with some deliberate speed on trying to fill those positions. I do understand that they are specific to category, one being ex-offender or ex-detainee, and the other one being someone from the legal profession. And I just want to remind our board, we've never had a lawyer in the 3 years. That doesn't include you, Barbara. We've never had a lawyer as a board member in the 3 years that we've existed. And so my hope is that the administration will continue to be flexible in this regard, and at least identify someone who is operating within the legal profession. That's what we've done for 3 years, and I'm hoping that that will not be an impediment to finding capable and qualified board members. And so right now we're 3 board members short. We'll continue to communicate with the administration to find out where they are in the process. I do know that I've had several people who have contacted me personally who have said that they have submitted application and that they haven't heard anything. And I'll work through our commissioner and through this administration to continue to urge and encourage them to fill those positions as soon as possible. So that's all I have as far as that. I want to move quickly. We do have panelists today, and we're very fortunate that their schedules have allowed them to be present. I'll introduce them, and then I'm going to ask the commissioner if she would to give the ground rules for the panel discussion. We want to make sure that everybody know that we strive to do things proper and in order. And now all I've got to do now is go down here and find the information that she sent me. Here we go. I'm older than everybody on this call, so it's okay if I'm technologically challenged. I had to switch from I'll just introduce both of them, and then we'll go in the order as it states on the agenda. The first person I'll introduce is Acting Commissioner of Corrections, Ms. Tammy Ross. As a homegrown professional of 23 years of dedicated service to the Division of Corrections, Acting Commissioner Ross brings experience and a deep understanding of the department's operations and mission. Throughout her career, she has worked in or directly with every facet of the division, gaining comprehensive insight into its administration and operational functions. She began her career on the administrative side, collaborating closely with the commissioners and administrative staff to implement innovative solutions for the division. Over time, her role expanded to focus on the custody side of corrections, providing training on various systems critical to the department's operations. This dual experience has allowed her to bridge gaps between administration and custodial teams, fostering seamless collaboration. In addition to her internal contributions, she has served as a liaison for the division, building working relationships with the St. Louis Metropolitan Police Department, in the 22nd Judicial Circuit Court, and the broader legal community, including public defenders, attorneys, and many other agencies. Her role in these partnerships have been instrumental in ensuring efficient communication and coordination across agencies. As Deputy Commissioner, she remains committed to advancing the division's mission, modernizing operations, fostering collaboration, and ensuring the safety and well-being of the staff, detainees, and community that we serve. And our second panelist, we call her affectionately Dr. Marty. And to be very honest and transparent, one of the reasons that we call her that affectionately, because sometimes we can't pronounce her whole name. But Dr. Marty,
Say
Dr.
it ain't
Davis.
so, Reverend. Say it ain't so.
No, listen, we're gonna be honest. We just gonna keep it honest, keep it transparent, and keep it real. Dr. Marty, we're gonna keep it real. But she's no stranger to our community. The job that she has done in the capacity as Director of Health for the city has been short of amazing. Dr. Marty was appointed Director of Health for the city of St. Louis in 2021. She is an internationally recognized infectious disease physician and an expert on public health and health equity. Dr. Marty earned her medical degree from the Cleveland Clinic Lerner College of Medicine and a master's in public health from Case Western Reserve University. She then completed her internal medicine residency at the University Hospital's Case Medical Center. Dr. Marty went on to complete her infectious disease fellowship, specializing in HIV and STDs at the Washington University School of Medicine. Also completing a one-year dedicated non-ACGME, she's gonna let us know what that means, HIV fellowship and a two-year dedicated sexually transmitted infection fellowship. In September 2023, she was elected as a fellow of the Infectious Disease Society of America, an honor that recognizes individuals who have achieved professional excellence and provided significant service to the profession of infectious diseases. Prior to her appointment as Director of Health, Dr. Marty previously served as a clinical instructor, Associate Program Director of the Division of Infectious Diseases Fellowship Program, and in the Office of Inclusion and Diversity Leadership at the Washington University of St. Louis School of Medicine. She also was an infectious disease physician at the Johns Cochrane VA Medical Center, where she was the lead HIV clinician, graduate medical education coordinator, and outpatient, parental antibiotic therapy supervisor. Her accolades and her experience and her expertise and her commitment is without question to anyone that knows her. And we're very grateful that Acting Commissioner Ross and Dr. Marty have made themselves available for our meeting this evening. And so again, thank you very much to both of you. And what we're going to do, Commissioner, if you would like at this time to make sure that everyone knows what the ground rules are.
Thank you, Reverend Gray. So our ground rules are as follows. Each presenter will have 15 minutes. At about 5 minutes of their presentations, I will inform them that they have 5 minutes to wrap up their presentation. I will just signal with my hand. And after both presentations have been made, there will be a question and answer period. If you have a question, please write your question in the meeting chat. Louisa Lyles of our staff will state each question for a response from the panelists. We just ask everyone to be patient, listen with an open mind, stay on point. Our motto is soft on people and hard on issues. Thank you.
Thank you very much. Let's begin with Dr. Marty.
Good evening, everyone. Thank you so much for inviting me back. I'm truly honored to have the opportunity to be here, and I use the word opportunity because these sort of presentations provide us an opportunity to educate and to have transparent, frank dialogue, because we all have the same priority of improving the lives of such an important population. I will share screen. I have some slides prepared, and I will try to adhere to the 15 minutes. I'm happy to be cut off if I am not as great in my goal to meet that 15 minutes. I'd like to introduce a new but extraordinarily impactful leader from the department who is with me today. Bodine Richmond, affectionately known as Bo, who is the manager that oversees oversight and evaluation of CJC with me. I want to credit him with the preparation of many of the materials that you'll see today, and he and his team are to be credited with the substantial amount of work and improvements there within. Can everybody see my slides?
Yes.
Thank you. I will get started. So I'm going to provide a chronological and historical background on the Department of Health's involvement, which it has only been a year, although sometimes it's felt longer. The Office of the Mayor requested the Department of Health take over oversight and evaluation of healthcare at the St. Louis City Justice Center last year, in October of last year, as the contract with the former healthcare provider at CJC was set to end on November 30th. Our department assumed oversight and evaluation of medical and behavioral health care at the St. Louis City Justice Center in October. We negotiated and secured an emergency contract with a new provider that began on December 1st. So just to provide that historical context, just getting something of that magnitude done at a high level was not an easy feat in 2 months, and I'm very grateful for the work of my team. DOH has now implemented policies and procedures for our oversight function, including monthly reports on healthcare metrics outlined by the National Accrediting Body for Correctional Healthcare, NCCHC. The city did not have a formal relationship with NCCHC prior to DOH's involvement, and we felt that it was important to have the National Accrediting Body, who are responsible for many of the standards on healthcare in the jail, to assist us in this new role. But the reason I'm giving this historical context is some people may incorrectly think that we are the provider, that we provide direct services, that we provide operational services. We do not. It is important for you to understand throughout this presentation that we provide oversight and evaluation. So DOH oversight includes collaboration with the mayor's office, the correctional team at the City Justice Center, the medical provider, PCUSA, and the National Commission on Correctional Healthcare, as I just went through. So the contract between the City of St. Louis and the healthcare provider known as Physicians Correctional USA, who I'll refer to as PCUSA for the rest of this discussion, started on December 1st, 2023. It provides for the delivery of reasonable and necessary medical, behavioral, and dental care to individuals under the custody and control of the city and detained at the CJC. The scope of services for this contract includes receiving and screening detainees within 4 hours of arrival at the facility, an initial health assessment of each inmate within 14 days following admission, inmate requests for health services triaged within 24 hours, appropriate and timely medical detox services, regularly scheduled sick call, nursing coverage, regular physician visits on site, infirmary care, hospitalization, medical services, emergency medical services, medical records management, pharmacy services, health education and training services, and a quality assurance program and administrative support services. The mental health portion of the services includes mental health assessment and evaluation at intake, at the initial health assessment and in segregation, crisis intervention and suicide evaluation, medication administration and management, group treatment, discharge and aftercare planning, on-call services during nights and weekends, for suicide attempts, behavioral health assessments identified during receiving screenings, psychiatric medication emergencies, psychiatric evaluation in housing units, and collaboration with medical staff on an integrated plan of care. That's a really long list. So to be clear, this is standard of care across contracts, and we are very aware of the historical context that was challenging. So the reason that we believe that our role has been integral is because someone has to be overseeing and evaluating these with the hopes that we can continue to serve this population well. So the healthcare provider PCUSA is supervised by the Department of Public Safety, and then we have oversight and evaluation services as the Department of Health. They are held accountable by a team of employees from these departments, including the Director of Public Safety, the Commissioner of the CJC, Director of Health, Commissioner of Health, the CJC Health Bureau Chief, and the Behavioral Health Bureau chief, both within my department, as well as members of my team, a government services analyst, and our epidemiology bureau supports these oversight and evaluation function. Our role provides, again, medical oversight and evaluation focused on ensuring PCUSA is consistently meeting the National Commission on Correctional Healthcare standards, using evidence-based practices and protocols to deliver the best care possible to residents and inmates, and perpetually making programmatic improvement as we identify them. The current collaboration between all stakeholders comes in the form of routine discussions and meetings. So one of the new things that we implemented was that there were regularly scheduled meetings. Back in December, I had these multiple times a week, then weekly, and now we have a regular cadence as needed with all the different providers that you see on the screen. These include, but are not limited to, the Department of Corrections, DOH, and PCUSA's meeting weekly to discuss the previous week's activities as it pertains to healthcare, specifically those pertaining to inmates sent to local hospitals or those who have been identified as needing more focused medical or mental health related services. So my background is in quality improvement as it pertains to healthcare, and it was important that we were having more dialogue, bringing the necessary partners to the table, being able to triage in real time, and not operating in silos, trying to see and have everyone here at the same time where the challenges were. The DOH and PCUSA meet weekly as well to discuss similar issues with a stronger focus on care delivery and meeting standards. Lastly, DOC, DOH, and NCCHC, who are under contract with, as I previously stated, meet bi-weekly to discuss the corrective action plan that we have built and that I will speak to later. So you should understand from this that we were very intentional about understanding who all the stakeholders involved in healthcare being delivered, and then trying to improve communication and keep a consistency around that communication to see an improvement in overall services. So let's talk about the healthcare provider staffing, and this is particularly talking about PCUSA. So again, we had 2 months to identify a provider. If you think about this from a business model, if the old provider had left with the entire team, we would not have had enough time to recruit every single new position. So we retained a lot of the people that worked under the prior contract, which means that there's an additional aspect of changing some of the culture, standards, and expectations, and onboarding new people. So all leadership positions are filled currently. That is a huge feat because being understaffed has been a chronic challenge across all city departments in most government systems. The leadership team consists of an on-site support by a medical director, health services administrator, director of nursing, and director of mental health. The most recent hire, the medical director, is one I'm very excited upon, who joined the team after a lengthy career serving as an internal medicine and palliative care physician at BJC Healthcare and Washington University School of Medicine. There are approximately 1.5 FTE nursing positions still open at the moment. PCUSA is actively interviewing for a full-time nurse in addition to part-time nurse and an LPN to strengthen their bench. This is a dramatic improvement from where the team was just a few months ago, where they were still using agency physicians and nursing to staff their teams. And let me again tell you that the reason that I always come back to the relationship with NCCHC is I'm constantly asking them, are we far away from where the national standards are? And for all of the challenges that I know we all hold accountable the city to around city jails, the recruitment and retention of folks who work in jails is a challenge across the country, as we are constantly told by NCCHC. So I'm particularly proud of both of our recruitment, retention, efforts, and the training to improve culture for those working there. The full complement of staff consists of some back office support, but relies heavily on their frontline clinical team. Members of that team include physicians, a dentist, an NP, nurses, LPNs, a pharmacy tech, mental health professionals, and a discharge planner. The newest team member is the discharge planner. She is responsible for coordinating re-entry efforts for newly discharged inmates and works closely with individuals from our Behavioral Health Bureau here in the health department and the CJC health team to identify resources the inmates may need post-discharge. So once again, one of my approaches to care is to look at a cascade of care. 5 minutes? Thank you. I'm not doing well, so we're just going to continue to power through this. So we want to make sure that we're looking at prevention, what's happening in the jail, and then how people do once they leave. So over the past year, we have, as I said, developed that relationship with NCCHC. they give us a report, and from that, we've developed a very comprehensive corrective action plan focused on 3 primary areas that came out from site visits and my team's internal oversight. That's intake, detox, and suicide prevention. Once we identified those 3 priority areas, we set up committees for each of those 3 areas. So there is committees from the Department of Corrections, Department of Health, and PCUSA team that get together around these 3 priority areas of intake, detox, and suicide prevention. Our Bureau also implemented and continued to provide training for all correctional and medical staff. Examples include man-down drills, suicide prevention, and Narcan use, and the parallel trainings and this corrective action plan with committees that are that are trying to improve this has been one of the key measures that, for the reasons that we've seen these notable improvements. So currently, the average daily census for 2024 was 722 inmates. This is compared to 550 in 2022 and 633 in 2023. So let's talk about how we are tracking those 3 priority areas, starting with intake. So for each of the priority areas, we have target areas. So the target is that we perform within 4 hours and that we address physical and mental health for intake. And then for the initial health assessment, the target is that that is performed within 14 days and that we focus on the health history, vital signs, and the physical exam. Then we've created a data system and a tracking method that's above your screen, where green is where we're having satisfactory improvement, yellow needs improvement, and red is an area of concern. So whenever we see an area of concern, that is where we prioritize our time. But you can tell that even in this 1 year, which is truly unprecedented, we've been able to move a lot of these areas into the green zone. And again, we track those on a monthly and then annual basis. The health service request pathway is the method that inmates use to request healthcare in CJC and to provide feedback. To make a request, they need to complete an electronic or paper form. This allows them to communicate their health concerns in detail. The same request can also be made by correctional officers and medical personnel. Requests are classified as an emergent within 24 hours, urgent within 48, or routine 24 hours initial and within 7 days. Since the CJC monitoring report began in March of 2004, the number of requests has been tracked, and we have seen vast improvements, and I will show you here. I can't go into this in detail, but you can see that every single one of these metrics is in the green as well. So not only are we raising everything to national standards, but we are tracking this and we are providing visual reports and data so that people can see easily where they're going. Another area that we pay special attention to is serious inmate events. So we evaluate those very quickly within 24 hours. We create a report that's generated by a health provider. So this also includes when we get alleged concerns, grievances, or even people saying that something is happening that is of a negative nature. So we have built an actual system to address those. We immediately elevate it to my level. We generate a report. The process breaks are identified, and then we develop an action or implementation if needed. We also have a debriefing within 24 hours for inmate deaths. So frontline staff are involved and the same actions are above. And as you know, we have had 2 deaths to date, 2 dates in the last year, 2 deaths, which is a dramatic decrease from prior years where we were having as many as 5 to 6 deaths previously. So a lot of these improvements are yielding positive events. I had my team do something for the purpose of this meeting just to underscore the fact that while I understand that there's a historical expectation that medical care is not prioritized or implemented appropriately in the jail, we have tracked all of the complaints that we have gotten either from lawyers, judges, people in the private sector, and families, and implemented the process that I just shown you. And to see, was there truth to that complaint? Was it partially true or untrue? This graph will give you a sample size of those. And many times, even though folks believe that a grievance has to be true and against the climate that we're building in CJC, most of those end up being partially true or untrue. There's only been 1 incident where there was a grievance that was untrue. And this ranges from people with mental health issues, attempted suicides, and very serious things. So I want to reassure people that we take these very seriously, we address them immediately, but that there should be a culture, not just the culture change that we are implementing, but also hopefully a culture change within community around giving us time to really see if there's credence, misunderstandings, or just overtly untrue aspects of this. I can address that more. So this is the data on jail deaths and overdoses. You can tell that in 2019, there was 1 death, 4 in 20, 1 in 21, 6 in 22, 23 was 5, and 2 in 24. So the time that we took over was 23 to 24. You can see a dramatic decrease, and now we're within range of the national averages within jails. The same thing for overdoses. This year, you can tell that there has been a trend towards those coming down as well significantly. I have more to say about this, but I know they're being kind to me about my 5 minutes. I can talk more in the Q&A around the work that we've done in deaths, but you can see on the screen that we have a targeted approach to knowing that we need to address this at intake. We need to work on detox and mental health protocols and serious inmate evaluations. We've also done a lot around jail diversion work, Narcan, education, training, and re-entry, especially the linkage to care piece as far as it pertains to overdoses. And again, if that needs to be addressed more. Care delivery improvements is we have updated and implemented new evidence-based protocols. We have placed mental health professionals in intake areas, and we have a contract with the Department of Mental Health around mental health screening and services as well. There's so much more I could say about this, but I'm trying to be respectful of time. As far as addressing mental health and substance abuse, the NCC relationship has made a huge difference, that corrective action plan I talked about. But we prioritize a quality improvement approach to healthcare in my department that we have also tried to implement in the CJC environment that really is helping with having a frontline of awareness of where the challenges lie. So we've also implemented a detox program to support the mental health challenges. And again, those trainings I talked about have been key. I'm not going to go into the trainings here, but I can give you more areas. This is a snapshot to give you an example of how detailed we are around the corrective action plan. It has 30 different indices, but you can tell that we have the focus area, the issue, what action we're taking, who's the responsible party or parties, the implementation date, what metrics we're using, how frequently we are providing feedback and updates as we go along. This is a living, breathing document, so it does not exist in a vacuum. I feel like I talked a lot like a rapper, and I got flashed for my 2 minutes. It is impossible for me to tell you the plethora of work that the Department of Health, DOC, and PCUSA have really worked on this year to improve medical services. I always say that I'll never be happy with it until every single resident in CJC is thriving, feels safe, and is healthy. But I do also say that we have to acknowledge the significant improvements as they lie, because every single person, whether it's an internal auditor or an external one, has said that this has been nothing short of exemplary work that has been done thus far. I will stop there, and I'm happy to take any questions.
Okay. What we'll do, per the commissioner, we will hear from Acting Commissioner Ross, and then I know that there are some questions already in the chat, but I want to ask if we could amend one requirement, Commissioner, for the board members. And I know that Secretary Walker has been our resident medical representative because she's worked in that area. At the conclusion of Acting Commissioner Ross's presentation, if we would allow Secretary Walker to ask questions, I think most of the questions that she'll ask have been questions that we have, as a board, have been concerned about over the last few years. And then the remaining questions, if they can go into the chat. The commissioner and I work very well together. So if we could just amend that restriction to that after Ms. Ross for Secretary Walker, and then we'll resume with the questions in the chat, because I know that there have been a couple. Commissioner, are you okay with that?
Yes, that's fine, Reverend Gray.
Thank you so much. Acting Commissioner Ross, it's good to see you. Last
Good to
time I
see you
saw,
too.
last time I saw you, I gave you a hug.
Thank you.
You're welcome.
You did.
You hugged me. You hugged me back.
And
You
I
hugged
hugged
me
you
back.
back. I
You
did.
hugged me back. Yeah, I
I
think
did.
that's important to know.
Yes, sir.
All right,
It is.
you have the floor.
Good afternoon, everybody. Members of the Oversight Board, thank you for the opportunity to speak with you today. I'm excited to be here. I am Tammy Ross, Acting Commissioner of Corrections. And I'll bring up my slide. I want to thank Ms. Brown from the Department of Public Safety for assisting me with this. So let me share my screen. Here we go. Detention Facilities Oversight Board, DFOB panel forum. This slide right here shows our population as of today, which is 786. 92% are male, 88% is female. The mission of the Division of Corrections is to ensure secure, humane, and professional environment for detainees who are awaiting trial while in our custody. These individuals remain in our custody for two reasons. Either they are unable to post bond or they are to be held without bond. Regardless of their charge, convictions, or the matters related to this case, it is a vantage point of all who lead or work at the Justice Center to ensure their safety and security. As of January 1st, like I said, there were 760 detainees under Division of Corrections. So who's actually in our care? Of the 760 total, 8% are females, 93% are males, 83% of the population is Black, 17% is white. The largest percent of our population are within the age range of 18 to 24. 2 are under the age of 18, and 27 are age 60 or above. In order to maintain our commitment to uphold the highest standard of integrity, respect, and fairness of all detainees within our custody, the Division of Corrections is committed to continuous improvements. There have been multiple evaluations of the facility to improve conditions for those detained and aligned with national best practices. Our approach has been one that centers around the 3 A's: analyze, assess, and address 3 fundamental areas: quality of life, safety and security, and infrastructure. As it relates to quality of life, from May 3rd, 2014, the City Justice Center has seen unfortunate detainee deaths as a result of medical or natural causes, suicide, and drug overdose. Insights gained from the root cause of death as determined by the medical examiner officer, prompt the launch of systems and strategies to address each cause. You just heard updates regarding the great medical care improvement from the Department of Health. In conjunction with their progress reports addressing routine exams, mental health evals to address suicides, and detox and life-saving training measures for drug overdose, and the Division of Corrections has also made upgrades to the quality of food served to the detainees. The current contract specifically prohibits any meals with textured vegetable protein or protein pellets. Every inmate receives at least 1 hot meal per day, and menus are reviewed and certified by the contractor's registered dietitian as adjusted for age, sex, and activity according to the recommended dietary allowances stated by the National Academy of Sciences. Recently, there have been reports of judge orders received on behalf of a handful of detainees. Please know that we carefully review every medical request from the inmates. In cases of the orders from the courts, we have reviewed those and have found many of the claims, as Dr. Monty said earlier, put forward were not substantiated. We evaluate each request that comes in at the highest level. We do a chart review to ensure we are accurate and the inmate gets the care they need. As it relates to safety and security, the Division of Corrections is taking steps to ensure the facility is drug-free. The measures have included multiple rotations of K-9 units to identify and remove contraband, the introduction of advanced screening technology to better identify drug, additional screening of staff, visitors, and inmates for contraband, and requiring photocopy delivered of original documents. The mission of the Division of Corrections is to ensure a safe, secure environment for both staff and detainees. At times, use of force is necessary to uphold such safety and security. Situations that may require each measures include detainees refusing to follow directives, intervening in physical altercation with detainees, addressing the intentional obstructions of a panhole closure, which if left open could result in a security breach or facility unauthorized communication or exchange of objects between cells. And incidents where detainees throw bodily fluids such as urine and feces at correctional staff. Although use of force tactics are still needed and therefore deployed, it is also important to highlight that overall the use of force has steadily decreased. In 2021, there were 251 incidents. In 2022, there were 130. In 2023, there were 105. By the end of September of 2024, there were only 70 incidents of use of force. This decline is a result of several factors that were recently implemented. Integrating regular and annual training, equipping our officers with tools and strategies to resolve situations before they escalate to the point where force is needed, collaborating with mental health professionals to address disciplinary issues related to a mental health crisis. Since 2017, there have been 9 incidents classified as Class A or B in the use of force. This reflects that 99% of the situations requiring the use of force have not resulted in any injuries to either staff or the detainees. So that's very important. As it relates to the infrastructure, in Ordinance 71494, the City of St. Louis appropriate $12.5 million to the Justice Center. The Division of Corrections has invested nearly $19 million in upgrades to the facility. We brought on a consultant to address the administration with implementation of reforms related to housing and incident response. Infrastructure improvements were made to repair or replace cell doors, cell locks, bubble units on the 3rd and 4th floors, the intercom system, and automatic door controls. The current issue that is trending across the country is employment recruitment, retention rates, and in correctional facilities. It is important to note that the Division of Corrections experienced a decrease in staff. At the same time, it experienced a rise in population. Recreation time does depend on staffing. We currently only have 74 correctional officer positions filled out, and we're allowed 198 authorized. We currently have 10 correctional officer 2, that's our lieutenant position, and we're authorized 28. While we are able to staff the facility, this staffing level caused additional stress for our officers. From 2019 to 2021, a total of 85 CO1s, that's our officers, stayed in the profession with the city for less than a year. To increase the availability of correctional officers, we contracted with Gardaworld to provide additional security in the facility. Of course, our current recreation time is not what we want it to be. Some individuals are only leaving their cells for 1 hour per day. To safely and meaningfully change this, we must meet a minimum staffing threshold of 150 correctional officers. Our staffing numbers are low, but our facility is safe and secure. This reflects a national trend. We are working closely with the Department of Personnel to try to fill the open positions. The Division of Corrections and the city is offering a hiring incentive of $3,500, and we are currently interviewing candidates. Roughly 30% of our candidates we attempt to hire failed the background check or the testing part. We would like to ask that the Detention Facility Oversight Board to help us recruit correctional workers and help us combat misinformation. Check in with us directly to make sure you have accurate information on what is happening inside the facility. Misinformation can justly cause deep concern and trauma to the family members and the public. Looking ahead, our focus will be fostering stronger relationships with our key partners, stakeholders, and volunteers through regular communication, feedback session, and joint intent to increase stakeholders' satisfaction, volunteer participation rates, and successful program outcomes. We currently collaborate with 6 divisions or entities that work closely with us maintain our mission, that help us maintain our mission. We recently collaborated with the Prisoner Processing Unit to effective management for our intake process. We work to digitize the professional meetings between detainees and the Missouri State Public Defender's Office. We've started communication with the new sheriff, Montgomery, and we've worked on the continued access by the Detention Facility Oversight Board. The members can have access to the facility when they want if they follow the appropriate procedures that are put in place by the ordinance. We have not turned anyone away. We do want individuals to be trained and be safe while inside the facility. We do have to ensure that inmates who have representation and their representation have been notified before speaking with the Oversight Board, and that protects them, their Sixth Amendment rights. We would also like to conduct monthly meetings between the board members and ourselves. In the next few weeks, we plan to release an RFP to decrease the cost of inmate tablet use and phone calls. We know that these efforts can be critical in decreasing tension at the facility and improving outcomes once an individual is released. We will be inviting the detention facility oversight to tour the facility and the attorneys, if granted permission, to have the board members meet with our dorm representatives. We will be reviewing and implementing recommendations provided by Mr. Burris, who is currently contracted to help improve our facility. I want to thank you guys for this opportunity, and yes, I was nervous.
Thank you very much, Acting Commissioner Ross.
Thank you.
Let's begin with Secretary Walker, and then we will look at the questions that are in the chat. I do have a couple, but I'll reserve mine for the end of the question period. Secretary Walker, you're on mute. Oh, there you go. And let the record reflect that board member Anita Lewis Walls is present at the meeting.
Good evening, everyone. Thank you so much. Thank you, Dr. Maddie and Commissioner Ross, for your great presentations. I don't really have any questions for Dr. Maddie. I do want to say that I am, as usual, incredibly impressed by what she has accomplished. And the more we can let the public know what the Department of Health is doing, the more reassured they will be. Dr. Maddie had an 80-hour-a-week job before she was charged with taking this on. And she has put in place in 2 months what we've been begging someone to do for over 3 years. And I cannot understate how impressive that is and how impressive her team is in turning this around to a patient-centered approach where they focus on prevention, diagnostics, emergency response, mental health. To add that component to what they're doing is truly life-saving, and we're seeing it in the results. I think we're going to continue to see it. It's a lot. It's complex, as you all know, because you deal with the health system every day and with your own lives. There's a lot of complexity to it. I'm sure she could drill way down in the data and tell us a lot more about what they're seeing and what still needs to be done. But I just encourage everyone to not be shy about asking your questions. We know the healthcare system's confusing, and to add this population to that system, many of who have come in with no healthcare at all for probably their entire lives, it's an uphill struggle. And if we see the kind of improvements over the next 6 months that we've seen in 2, I think we'll be able to hold this up as a model and say that something really tremendous has been accomplished in the city jail. So thank you, Dr. Maddie. And please ask any questions. I'm sure she can explain it in her articulate and patient way to all of us. Thank you.
I just thought of something, Commissioner, because I don't want to be accused of favoritism. There are questions in the chat. Other board members, I've noticed that they haven't placed any questions. So I hate to assume things. I suspect that those questions in the chat are public questions and our comments. Other board members, do you have any questions to Dr. Mahdi or to Acting Commissioner Ross? And then we'll go directly to the chat. Board members, I don't want to be accused of favoritism with Secretary Walker. Other board members? Seeing none, then Ms. Louisa, I understand. And board members, if you have questions that come up, just please raise your hand. Ms. Louisa, I think that you will kind of facilitate the questions. You'll ask the questions on behalf of those in the chat. Is that my understanding, Commissioner Barbara? Is that?
Yes, Reverend Gray.
Yes.
Okay.
That's correct.
Okay. So Louisa, I'll
Louisa?
turn it over to
Yeah.
you and the question.
Okay, Reverend Gray, there are questions in the chat as you spoke earlier, but there's also a couple in the chat that I will answer as well. One of the questions that we were asked were from Ms. Webb, and she was asking whether or not the Division of Civilian Oversight has had an opportunity to have access to videos and do investigations. I would like to say for the CJC, or I'd like to say that last month we had an opportunity to meet with the Division of Corrections. And at that time, we discussed the capability of our office having access to video and also to telephone recordings. So we are collaborating on developing policy and procedures where we will have access to that type of information. The other question that Ms. Webb asked was, how do people have an opportunity to have access to file a complaint? In our office, there are 3 methods in which you can do it. You can go online. If you go to the Division of Civilian Oversight website, you can actually go in and fill out a complaint form online. You can also come to our office. It's located at 1520 Market, room 4029, and you can file one in person. Or you can call our office. Our office number is area code 314-1600, and we can mail you a complaint form. So that is the 3 methods in which you can do so. And all complaints are then forwarded over to the Division of Corrections. So information is being shared. The next question is, they asked whether or not the board has an opportunity to do any investigations. No, they have not at this particular time. Stacy, I want to mention the last name. Stacy asked the question, how do we audit the revenue generated from commissions from the commissary and phone minutes, and where does the money go? I believe that question would be for Acting Commissioner Ross.
The money that is generated for commissary and phone actually goes back into the inmates. That's when we purchase different things for the inmates to use throughout the facility, or different things that we will use towards the inmate. That's where the money goes, the funds go.
There's another.
Sorry about that. I just muted myself. They also asked would they be able to see, I guess, basically a report that would provide information as to where that money is going to. Is it in your I would say in your annual report or something of that nature for the general public?
Let me look into that. I'm not sure about that. That's probably something we can do. We can provide an update on where the money goes.
At this moment, I don't see any additional questions in there, in the webpage, but I will say when I do ask a question, give me a few seconds, because when I don't unmute, I'm not muted, then they can't hear you as well. Are there any other questions that someone would like to send into the chat?
Louisa,
Okay.
we do have another question that was sent to me by text message. And this question is directed to the healthcare director, Dr. Mati. How were you able to determine the veracity of the claims that you investigated? How did you substantiate or not substantiate? What did they look at, or who did they interview? And what kind of access did you have?
Thank you for asking. So whenever a complaint is received, I have a team of people that is tasked with asking the subcontractor to provide an interim report. Both the subcontractor and my team are also responsible for following up with every medical provider that interfaced with the patient. There's an electronic medical record that also has the charted information. And then the Commissioner Ross has always been a great partner to us because she's able to review video footage, and that is done as well, so that there is both sides. So this is through interviews, electronic medical record, video data when needed. I'm happy to take follow-up questions because I believe some of those questions were during my presentation, but I'm happy to address those as needed.
Lisa?
Ms. Webb is also asking another question, and she wants to know, when medical requests are filled out, it's her contention that they're too often not filled out, and they are being ignored by the medical staff. I believe that question would be for Dr. Mati.
Yeah, I'm glad that's brought up because I hear this a lot. I want to completely appreciate the frustration, the devastation in the community around historical and even some current practices. But we have done very many reports. You know, my department was never a part of CJC. We're an external department. I have a team of people. This is my community. I don't separate myself. This is actually my community. All of the people that work for me are by St. Louis, for St. Louis, right? And most of those claims that, you know, because we will get a complaint that says this person has never received medical care, and there is video footage that shows that isn't true. We can have people in medical that view this. We have people that come from the national accreditation boards that I'm here that are actually watching all day for certain days. And so it is just categorically not true, right? So if maybe people are oversimplifying and saying that the quality of medical care or all of the things that the person has asked for, or communication is always great, then I'm happy to hear you. But the categorical complaints, because it feels like sometimes this is a propagated message that people in CJC, at least since I've been doing oversight and evaluation, do not get medical care. It's not true. So then we talk about, well, how can we trust your investigation, which is a fair question. And that's why it was important for me to put multiple checks and balances, right? People from my department, people from CJC's department, people from NCCHC, video evidence, the EMR reports, as well as the patient charts. While I know that people would want to be able to evaluate it at the level that I am, you need to remember that medical care is HIPAA protected. That is a legal thing that makes it impossible for me to share the details of medical care. But if your concern is, oh, you're only taking the side of the medical providers or people who may not, in your mind, be genuine, we have other ways, speaking to the residents, but also watching actual video proof, and have an external body, right? The national accrediting body physically here. So I made it clear in the contract that they weren't just reviewing charts somewhere, that they had to come here on a monthly to bi-monthly basis and physically observe these interactions, right? Now, do I believe that we have a perfect medical system here? No, but I promise you that that doesn't exist anywhere. But there are multiple checks and balances, and it would be disingenuous and untrue, quite frankly, to say that there haven't been vast improvements. I am always welcome to conversations and suggestions around how we can be better or make people better understand what we're doing differently in the last year than years prior. But that is how I would address that.
Stacy wants to know if the DFOB will be empowered to have monitors within the facility at CJC who can monitor real-time conditions and report back regularly. I believe that question may be directed to Commissioner Ross and maybe even possibly Reverend Gray.
Let me say first before Acting Commissioner Ross, we're very clear, or we've tried to be clear about what the responsibility of the board is. The board's mandate is to provide oversight. We do have a staff, the DFOB staff, and their mandate is to do the investigation. I think Ms. Ross has indicated, based upon the conversation and commitment that I had with the former Commissioner of Corrections, Commissioner Jennifer Clemens Abdullah, what I heard from Ms. Ross is that she's going to honor that commitment as acting commissioner, and that the DFOB staff on a regular basis will have an opportunity to have access to CJC, which I'm suspecting that means whatever individuals and materials, etc., will be necessary to complete an effective and efficient investigation. And so as far as monitors, our monitors are the staff. And Acting Director Ross has already indicated that she is committed to the commitment that was made previously by her predecessor, and that our staff will have that access. To me, as a board chair, and I know we might use the word monitor, but our staff are charged with doing the investigation, and our board is charged with oversight. And so having anybody there other than that, I don't think that that is pursuant to the ordinance. And Acting Commissioner Ross, if I've said anything wrong, or if you want to add anything to that, please feel free.
No, I do agree. I stand committed to the ordinance that was passed by the city of St. Louis. And yes, your staff is welcome to come over once they've followed all the rules that's set by the ordinance. Of course, you can come over to the facility.
And to be specific, as I said, as a board member, I've made it clear, I don't necessarily need to do a tour. I am confident in the DFOB staff under the leadership of our current commissioner to be able, as long as they have the access, and Acting Director Ross has indicated they will have that access on a regular basis, that as long as they have that access and able to get the information that they need to do their investigation, I think that that is all that the board is requiring or asking the DFOB staff to do. And I think that that access by our staff is sufficient. I know that we're in the beginning process of that relationship. Secretary Walker has made it very clear in both instances, we're getting things now. Grandmama say better late than never. I have a question that I think is maybe to both. Dr. Marty talked about the investigations that they do as it relates to medical complaints or concerns. Is it possible, Dr. Marty and Acting Commissioner Ross, is it possible that the DFOB staff could also be privy to not necessarily the investigation and or the outcome, so that if we're getting a complaint for the same thing, and you're getting that complaint, Dr. Marty, and you've already investigated it, it seems to me that if we're working in conjunction or in collaboration at some point, then DFOB staff, based upon your investigation and the conclusion of that best investigation, could utilize that information to close a case. And so is that doable, feasible for DFOB staff and I'm not saying, I understand the HIPAA rule, but I'm saying, is there some way to collaborate so that what we're not doing is overlapping? Because if you've already done the investigation and we have to come in and do an investigation that you've already done, so I'm asking if that's something that is doable, or does it even make sense?
I'll speak to medical and then I'll ask Commissioner Ross to take it from there. Our role, which I kept repeating, was oversight and evaluation. So I'm not the last decision maker around what an external entity, including members of the public, can do. I will work very hard in partnership where those decisions are made, but the ultimate decisions around what can and cannot be done in CJC are at the purview of the Commissioner of Corrections and the Director of Public Safety. My role is to provide recommendations, but my department does not make final decisions, right?
Okay.
So if those discussions were to happen at the level of the Department of Corrections and the Department of Public Safety, I would always offer my partnership and my recommendations in my position as the Director of Health and in this role that we have of oversight and evaluation. Commissioner Ross?
I think Dr. Mahdi is correct with that part. Myself and Director Coyle can get together with your group, the Oversight Board, and we can discuss that. But as long as it's not a part of litigation or anything,
Right,
you should receive information. The final information, that should be fine if we've already investigated ourselves.
right.
So
Okay,
we can discuss that at our next meeting.
No, that's fine. I thank you. And I guess my last question, Dr. Mahdi, you talked about data, and one of the concerns that we get a lot is in. Let me rephrase this. It's been stated by the Director of Public Safety, particularly in the issues of the deaths, however they've occurred, that oftentimes the medical staff or the detainee doesn't even know their health problem coming in. And because they don't know their own health problems coming in, it is difficult to do a proper analysis and processing to determine what kind of medical needs they may have. And so, and you may have already mentioned this, but is there a mechanism in place where, as detainees come in and their names and date of births or whatever they give is placed into the system, that system is also part of the medical system? I mean, for me, I know if I go to urgent care, they'll treat me, and then my medical history will then be made available to my primary care physician. So when I go to my primary care physician, he already knows I've been to urgent care. This is the treatment that I had, and then he can talk to me about that. Is that something that is that too elaborate? Is that feasible? I know my question, Dr. Mahdi, you're much more advanced with this.
No, it's a great question, and you're getting to the heart of some of the comments and the question. So I'm going to give you an example, and then I'm going to address the question directly. So good. I worked at Washington University, which is a top 20 hospital in the nation. When I directly see a patient, I need the patient to have the most available information. Can they tell me reliably their name, their medical history, and their medications? Then I have to make sure that that information is in the electronic medical record. Does the electronic medical record have that, right? Even at WashU, there are delays in getting a new patient and being able to verify that. I would have my medical license stripped from me if I just assumed, especially a person who is confused or in an emergent situation knows every single part of every medicine in their dose. I'm actually not allowed to, by my Hippocratic oath, right, just provide people medication because of their memory, right? So that means there has to be a process in place. The United States as a country does not have universal healthcare. I mean, a universal medical record system, which means The EMR that is used at the CJC is not the same as WashU, is not the same as the VA, is not the same as flu. They do not communicate. So when an inmate comes in, and usually an inmate comes in with very serious health conditions, sometimes injuries, sometimes they already have valid mistrust because it is valid for them not to trust government agencies, right? That is across the board in our country. And so the communication may not be reliable. And then we are at the mercy of their memory. We are at the mercy of law that allows us not to reach out to certain persons in certain ways. Even if I called CVS today to say, I would like to see if you have this person's medication list, I have to fill out a form. I have to wait for CVS to get to it. So sometimes we know people have medications that they need to get that day, but it is medically irresponsible for me to just go on the recommendation of someone. So if that is a challenge at a world-class institution, as much as I want to get the CJC medical to the level of WashU, it is not, and it is not anywhere in the country. I asked NCCHC straight up, are we so much worse than other jails that you do this work in? And they do hundreds of these across the country, right? They say things are challenging, but this is not outside the range of what we see. So the jail system in medical care is broken across the country at a global level. Things are very challenging in St. Louis. I am not making excuses for any of the egregious cases, but there are very serious system barriers that prevent us to be able to get a patient's accurate medication list the moment they hit CJC. And if people don't pick up a fax that we send or don't pick up a phone call, add to that the challenges that we own. We own the fact that we don't have a full staff. We own the fact that we don't have world-class doctors like some of these hospitals, correct? So is this devastating? Absolutely. Are there challenges? Yes, but there is no system that allows us in real time to make sure that that information is accurate immediately. A lot of people will say, and then there are other complexities around what we are allowed to do or not do by law, by city policy. Those are what's outside of my purview. But anywhere that I have been able to make system improvements, medical reconciliation, which means being able to get accurate medication lists, was one of my first priorities when I came in. It was absolutely unacceptable to me when we were doing audits that we would see that there would be sometimes that people weren't getting certain medications. Our data shows that that has improved. Is it where it needs to be? No, right? But the challenges that we immediately identified are the ones that I just described. Having a full fleet of staff, having the ability to get the information in a timely fashion and do so in a way that is medically responsible. Because if I were to go on someone's memory and God forbid they didn't remember a number, a dose, or even the name of the medication, and we gave them a wrong drug, now we're responsible for a serious outcome or not a death. So there are no easy answers, but I want you to know that the people that work for me love their community. We're not here waking up trying to think of ways to hurt people or harm people, but we're also undoing many years of challenges and the existing challenges within the medical field in the United States, on top of the fact that jail medical care is not nearly at the level it needs to be. Does that help, Reverend Gray?
Oh, no, that's, Dr. Marty, you had me at hello. That was an excellent explanation, because it is I think it's the question that we get on a regular basis. And as an oversight board, part of our responsibility is to inform and educate. And you, I believe, I can't speak for the board, but I believe you've done an amazing job in helping us to understand, particularly that medical side of it, and it helps us to explain when we're asked as much as we can to summarize what you just said. So thank you very much. Commissioner, are there any other questions in the chat that that have not been answered that we need to get to?
Yes, Reverend Gray, we have received some more questions. How would you like to proceed? Do you want Louisa to identify those questions at this point?
Well, what I think might be easier, Dr. Marty and Acting Commissioner Ross, do you have access to the chat? Can you see the chat?
Yes.
It might be easier, Madam Commissioner, if they would just respond to the questions as they see it in the chat. And that way that would avoid us having to go back if they're comfortable with that. Dr. Marty, are you comfortable with that? And Acting Commissioner Ross, are you comfortable with that? And what I'm going to ask the public to do too, typically what we do, particularly in public comments, we'll give folk 3 minutes. And I think that we've been extremely, I don't want to use the word generous. I think that we've done more than that because we've had, rightly so, we've had some people have asked multiple questions. But we want to get to those questions as quickly as we can. We want to get them answered as thoroughly as we can, and then we need to move on to our agenda. So, Acting Commissioner Ross, do you see any questions that are under your preview that you can answer? And then Dr. Marty, and then we'll thank our panelists, and then we'll move on to the next agenda item. Ms. Ross?
Commissioner Ross, I'll help so that we can tag team. There's a power of attorney advocate for a citizen's son. That would be within your purview. What would you advise?
Which question was that?
It says iPhone 6:07 p.m.
6:07 p.m. I can agree. There is evidence we can address. We need to address the feedback too.
Oh, and let me caution everyone. If it is a question, let's respond to the question. If it is a comment and or someone's opinion, I would say to the panelists, you don't have to respond to every comment made. We made it very clear that if people have questions, let's get the questions. But comments, I'm going to leave that to your discretion.
Thank you. Commissioner Ross, it's the one that says, because there's two that say 6:07. It says, what is actually in place to allow me to be automatically POA advocate for my son who has been deemed mentally incompetent?
So that person can actually call and talk to me. I'm not sure who it is, iPhone. You can call and talk to me or the caseworker or the unit manager, and we can definitely be an advocate for your son and try to help you with some information that's needed. And you can email me, call my number, and I can you can stay on and we can talk afterwards, or you can take my email down and you can email me and I'll call you and speak to you about your chat.
Could you put the contact number for the CJC to your office in the chat and your email?
Sure will.
Commissioner Ross, Stacey Strozer talks about conditions in the jail as well as witnessing correctional officer. It has a question at the end, the 619 Stacey Strozer, but a lot of it is comment.
Okay, thank you.
Okay. All right. Any others?
Let me address this 619. If you also, I'll put my information in, you can call and let me know, we can have a discussion. Majority of the time, and Dr. Marty, you maybe can speak on the medication wise. The jail, we don't give narcotics. They may be sent back from the hospital with the hard narcotics, right, Dr. Marty? We don't provide those inside the jail. I think you're on mute.
I like to responsibly answer questions. So without knowing more details, again, Commissioner Ross encouraged, and I see Teresa Waller has already provided her name. If you could follow up and give details to Commissioner Ross, she will get me any that are relevant to medical, and then I can address those directly. Trying to give you an opinion on an investigation from a chat is just not responsible. So I want to acknowledge, though, the really heart-wrenching and sad case from iPhone at 619 about what happened with your son. I'm so sorry. And you talked about that 2 years ago, and I can imagine that it feels as real today as then. Your question at the end was medication miss, was a negative approach given toward him or what? Again, I don't know what happened 2 years ago. I wasn't there 2 years ago, but anytime that we see a medication missed, we always have a follow-up meeting to see how we can strengthen. But again, those challenges I tried to outline against how difficult it can be to get the correct medical information are very difficult. As well as if medical care cannot be provided in CJC, we actually encourage that the hospitals keep someone until such a time as they can give them. It is not fair to expect a jail to provide hospital level or ICU level care. So that's something that we really try to avoid as well. But so I wanted to acknowledge that I see your case. It's devastating, and I'm so sorry. But I genuinely, and I hope you understand, cannot speak to something that happened 2 years ago. But as far as medication, if you have a follow-up question, I'm happy to address it.
And I'll address Ms. Weiler. Hi, Ms. Weiler. We've talked several times about your son. I was actually able to coax him out of the cell last week to visit you, and I didn't have any problems. He actually listened, and he came out. Now, I didn't go up there today and assist with him visiting you. What I would suggest you do is email me and let me know when your visits are scheduled, and I'll go up and assist staff with, helping him come out the cell like I did last time.
Those are the only questions I see at this time.
Okay.
Oh, sorry, there's one new one that happened.
And and this will be the last question.
So let me address the board. I'm actually in the process of putting the forms on a tablet, so they'll be able to fill out the forms, and it'll go directly over to, I don't know if it'll go directly to Oversight because the tablets don't connect to the internet, but what usually happens is we'll have staff print them all out and we'll forward them to an email that you guys provide us. So I'm in the process of adding them to the tablet. The complaint.
Thank you very much.
There's a last question from Stacy Strozier, 625 for the board, Reverend Gray.
Yes, and what's the question? I'm sorry. Let me see if I can.
How do we engage in outreach to inform detainees that the board exists? How do we provide better resources to the board to do real investigations?
The resource part, I'll answer that question first. I think that we've made a huge step in access. I believe very firmly that with the commitment that Acting Commissioner Ross has made this evening to engage with the DFOB staff on a regular basis, to provide access to the staff, to provide access to detainees or materials in order for them to do an investigation. I think that it's a huge step. It's 3 years in the making. So I want to thank Acting Commissioner Ross for making that commitment. I know as our commissioner has stated, they've already had one meeting. Grandmama said the proof is in the pudding. I'm optimistic today, and so staff will begin to do that on a regular basis. That's the commitment. We heard it prior to this meeting. We're hearing it at this meeting, and now we've got to let that part of it happen. As far as the board is concerned, ours is a slippery slope as a board. We have a lot of people on the board who are advocates. And what we've been able to do, and I know Secretary Walker and board members, Dom and Ms. Lewis Wallace can attest to that because we've been together for 3 years. We found ourselves very often being advocates or just trying to provide information. And that became our role because I'll use this word, we were not able to do other things for various reasons. And so now I think we are at a juncture where our staff can now do what the DFOB was created to do, and that's to do effective, thorough investigations. And so I'm hoping that you will see in future meetings as we talk about complaints and investigations, you'll be able to see that. I know that this board is committed to fulfilling its obligation as outlined in the ordinance. As Dr. Marty said, this is our community. We've made it very clear that we see detainees, we'll always see detainees and staff as human beings. And we're concerned about everybody's safety, everybody's security, everybody's health in that building, full stop. And that's always been the role of this board. And so I know there are other comments, there are other concerns. I would continue to say, if you have concerns about what is taking place in CJC, please contact our DFOB staff. And I know that, and I see that Acting Commissioner Ross says she'll monitor that progress herself. And she knows that we'll be monitoring it too. We've got a very capable commissioner who believes in crossing the T's and dotting the I's. She's an organizer. She's organized. And so let's see where we go from here. This is the phrase of 2025, Dr. King's phrase. Where do we go from here? Well, let's see. I think today, this meeting, we haven't gotten this kind of, Pam, we haven't gotten this kind of information in a long time. I'm trying to, I mean, Dr. Marty was on before and she was phenomenal. She continues to be phenomenal, if that's even possible. I'm grateful to Acting Commissioner Ross. I think that this has been, in 3 years, our best information-oriented meeting that we've had as a board, bar none. And that takes nothing away from other commissioners, other staff. Again, we've got a staff par excellence. We've only asked that they be allowed to do their job. And so with that, thank you, Mother Jamala. We're going to continue with our meeting. I do want to say thank you to our panelists. If we'd had more than that, we wouldn't be able to do what we needed to do. Thank you, Commissioner, for bringing me off the ledge. Thank you for doing that. I think the two panelists that we had really accomplished, I believe, what the board wanted and needed to do tonight, going into this new year. Any other board members have any other brief comments before we move to the next agenda item? Any other board members? Seeing none, thank you, Dr. Marty. Please give my fraternity brother my regards. Tell him I said, Roo.
I sure will, Reverend.
I do want to say,
thank you so much for having us. Sorry, Reverend.
I want to say, to the credit of Ms. Ross before she leaves, I have received, individual people have called me because of my position with the board about concerns of individual detainees. And what I have done, immediately, I will call either the CJC or I'll call the staff and ask them to do a wellness check. Mm-hmm. In every single case, and please, people, call the staff. Don't call me. But if you happen to call me, every case where I've been called and have asked the staff or asked CJC staff to do a wellness check, they have done it in every single instance. In every instance, they've done it. And they have not only have they done a wellness check, but they've responded to family members in real time. And so I know I've been the biggest critic of CJC. Y'all know that. I put my hand up. But when people are doing right, you need to say people are doing right. And so I want to thank the CJC staff for responding in real time. And so with that, you're more than welcome, panelists, to stay on. But if you have to go, we will understand that as well. And now we're going to move on. Training and orientation schedule, Commissioner. I don't know where we are with that. Oh, and everybody that tuned in, all the people that gave comments and questions, thank y'all very much for that. Thank everybody who raised questions, made comments, continue to hang in there with us. Thank you very much. Commissioner, I'm not sure where we are with the training and orientation schedule. I don't know if everybody has concluded all their training, or what training do we have yet, left on the schedule.
Reverend Gray, I don't have an answer for you right now regarding that, but we will follow up. We are in communications with Nicole, and I believe she was one of the people attending the program, but we will follow up and get the information and let you know.
Okay, because we especially want to make sure that all of our board members have all of the necessary training that they need in order to be able to have access to CJC. So whatever training they have not done for that, we want to make sure, and Nicole has been helpful, we want to make sure that we prioritize that training for board members so that they have the access that they need.
Okay, will do.
Now we are on the second reading of the DFOB 2025 work plan. I think that Board Member Harper, we turn it over to you.
Okay, and I believe we can pull up the work plan. Answar, can you provide that, please? So I hope everyone can see the objectives and the key activities that the DFOB actually, I understand the committee of DFOB provided and worked and put together this work plan.
I think that Board Member Harper, I think that it was sent out to all of the board members. If you haven't received it for your review, and the intention at this meeting was if Board Member Harper had anything she wanted to highlight, or board members have any questions that they wanted to insert regarding the work plan. The only thing that I will add, Board Member Harper, and I do apologize for not putting it in writing, I would like to add as part of our work plan for 2025 to be able to review the ordinance that created the DFOB, to see if there are any additional amendments that the DFOB needs to recommend to the Board of Aldermen. So if somewhere, if you would be so kind, that would be the only addition that the DFOB will be reviewing the ordinance that created this entity to ascertain if there are other amendments that we would like to recommend to the Public Safety Committee and the Board of Aldermen. That'd be the only thing that, and I'll send that to you in writing, but I'm sorry, I forgot. I didn't need to be on screen to say that, did I?
Reverend Gray?
Yes, ma'am.
Ruby Bonner on our staff has looked at the work plan, and actually the work plan and the various ordinances.
Okay.
So we share with you, we want to make sure that the activities are certainly related to the requirements of the ordinance.
Okay.
And I believe Ruby would be able to provide that information to you and the board.
Okay. Should we do that now, or do you want to do that separately? Is it?
Reverend Gray,
Hey, Miss
I
Ruby.
believe Ruby is speaking now.
Hi.
Yeah.
Good evening, members of the board, Reverend Gray. I think one of the reasons why it was put on as a second reading, because it was the commissioner's point, and I couldn't agree more, that if the board is to provide an annual report by August of 2025, the sooner the board can review and comment and approve its 2025 work plan, the sooner the board can begin working towards its objectives, programs, initiatives, and that sort of thing, so that the staff can support you in the development of your annual report that will be required in August of 2025.
Right. Okay. So what would you recommend? I mean, you've had an opportunity to review it. Board Member Harper and the subcommittee, I think, has done an excellent job. What would you recommend will be as next step.
My recommendation, if the board will concur in adding your additional point, and I think it can fit very easily under the, I can't get my screen to move. Can you move it down a little bit, Answa, please? I thought there was a provision that dealt with the board's review of policies and procedures. And my thinking was just now that we could add a bullet point that speaks to a review of the ordinances in the event there's a recommendation for any changes within the ordinance. So that could become another of the objectives of the board. And then for the next step, if the board is ready with its approval of the 2025 work plan, I would ask the chair to consider a motion to that effect.
Well, let me ask board members, are there any board members that object to the document that you've received and that is before you with the additional recommendation that the chair has made this evening? I'll begin with the board member Harper.
I'm in agreement with that.
Board member Gay.
In agreement, yes. Sorry, I didn't hit unmute.
That's okay. Board member Lewis Walls. You gotta love Miss Ornitha. She always has problems with this. Is she still on, Pam?
I think so, but I can't see everyone.
Okay. I'll move on. Board member Dawn.
No objections.
Secretary Walker.
No objections.
And I don't have any objections. So it
Chairman?
seems to, yes.
May I ask a question just for clarity? On
Yes, ma'am.
paragraph 3, the last sentence where it lists all the departments and it says they need to report to the DFOB and approve the protocol agreement. What protocol agreement is that referring to?
Board member Harper, do you want to respond to that, or one of the members of the subcommittee?
Kanika, I can address it if you'd like me to. At one point, Barb, we were told that before we could get the monthly reports that are required under the ordinance by the sheriff, the coroner, the police chief, that there had to be an agreed to protocol and that it was being drafted and was being circulated. But that was several months ago, like 6 months ago. So we just included that. What we'd like to have happen is those ordinance required reports to occur, because I think a report from the coroner and the police department would be just as informative as what we heard tonight. And it is required by the ordinance. So I don't know.
Would it be clear to say approve any necessary protocol agreements, or I just,
Yeah. I mean, if it's not necessary, we don't need to do it, but somewhere along the line, at least that's what my understanding was that there had to be something everybody signed off on, like the policy and procedures thing.
well, you know me, I look at it with a view towards someone who, is just a person picking it up. So it'd be super clear for anybody in the world who, so I would recommend saying approve any necessary protocol agreement.
Totally agree.
So all we need to do, Barbara, is just insert the word necessary.
Yeah, I would say approve any necessary protocol agreement instead of the.
Board member Harper, you chair this. You're okay with that?
Yeah.
You're on mute.
Can you hear me now?
Yes, ma'am.
Yes, I'm in agreement. I'm just taking the notes.
Okay. So I
I
know
thought I heard Ms. Bonner, but I don't hear her now. So
Ruby, did you have?
I did. I just wanted to follow up with what Secretary Walker has said. And I
Yes.
believe the reference was initially to provisions in Executive Order 79 that required the DFOB and the COB to negotiate memorandum of understanding relative to getting access to certain records and documents of the sheriff's office, the medical examiner, and maybe even the circuit attorney. So I think that's what
right on point.
Secretary Walker might be.
Yeah, and I think that little
referencing.
tweak will allow us to just do that without any further delay or ado, you know?
Okay. So can we repeat the additions that need to be made
Yes,
prior to the board voting?
yeah, my addition was that we would that the DFOB board would be reviewing the ordinance that created the DFOB to ascertain if there are any amendments to the ordinance that our board wanted to recommend to the Public Safety Committee and or the Board of Aldermen.
Okay.
And then
Barb, can we maybe get together if the board will approve its 2025 work plan with those amendments, then Barb, you and I can maybe get together and insert those. And board member Harper or Walker, whoever was on the committee.
we have a small
Absolutely.
subcommittee. Yeah, we do have a small subcommittee so that we can make sure that we don't have a quorum in any of those meetings. So board member Harper, if you're okay with that, then I'll go ahead and call a vote. And then after that, at your convenience, meeting with Barbara and Ruby to make sure that it is crafted the way it needs to be crafted to move forward. If you're okay with that. Grandmother said don't ask people to do something and then don't let them do it. So I'm hands off. And so can we get a motion from a board member to accept with the additions stated this evening, the DFOB 2025 work plan? Is there a motion to accept? You have to come off mute. It's been moved by board member Gay. Is there a seconder?
I second it.
Second by board member Harper. And we have to do it. Barbara, do we have to do a face vote for this?
Yeah, anyone voting should just throw their camera on, and it looks like I can see most of the people.
Okay,
so
if your camera's on, and I think Ornith is the only one who won't have, but if your camera's on, if you take yourself off of mute for a moment, all in favor of the motion say aye. As a matter of fact, do this. All in favor of the motion, raise your hand. Then we can see. All right. Is that good, Barbara? You good?
This board member's
yes, it
on.
looks like no one is opposed.
No one is opposed. All right. All opposed, seeing none, motion carries. Excellent work. See, I love it when things work together. All right. So now we move down to Commissioner's report. Commissioner, you have the floor.
Thank you, Reverend Gray. We have been working on the various reports. Dotlin, our grant analyst, has been compiling the information. I am going to call on Dotlin to provide you an overview about what report she has been working on. And we would like to present the full reports to you at your meeting in February. She will provide an overview about the reports, but the full reports will be provided to you at your meeting in February. Dotlin?
Hi, everyone. Are you hearing me?
Hello.
I want to apologize. My current settings right now is not identifying a camera, so I'm not able to show a face to go with the name. I do want to apologize for that. My name is Dotlin Bedesi, and I'm the current Government Services Analyst for the Division of Civilian Oversight. Since my tenure began with the Division of Civilian Oversight on May the 22nd of 2023, I have been deeply engaged in analyzing and synthesizing data from various sources to develop meaningful analytics. These analytics are fundamental to the reports we present, which offer insights into key trends and patterns. Today, I am pleased to provide an overview of the reports that we have completed so far and the process involved in their preparation. So far, we have a DFOB combined annual and quarterly report for 2023. The combined annual report was through August of 2023, and the quarterly report was up to the period of September 30, 2023. There was also a completed DFOB fourth quarter report, which ended in December 30 of 2023, and a DFOB first quarter report ending March 31st, 2024. I'm currently going over the review of other reports that are due, and as those become available, we'll also present them to the board. Each report includes analytics and insights based on key categories like complaints received, demographics, inmate population data, inmate deaths, training metrics that the staff and the board has gone through. The overview of the process includes data collection, data cleaning and organization, data manipulation and analysis, compilation and drafting of the reports. It goes through a review and finalization process. Then we present to the board for review. Not all the reports are slated to be reviewed by the Detention Facilities Oversight Board. The annual accountability report is one such report that requires the board to approve. And once it's approved, it's addressed to the mayor, board of aldermen, and chairperson of the Public Safety Committee, and it's presented at a public meeting where we invite the public to comment on that. So those reports will be forthcoming in the near future. There are some key challenges, and we're working through those resolution. One such challenge we have is the variability in the data sources. And we have ongoing conversation to standardize data collection protocols to enhance consistency. Another challenge we come across is the limited data in certain areas, and that's also ongoing, supplementing the gaps with publicly available information, and we're cross-referencing multiple sources to ensure that the data we're presenting to the board and the public is authentic. The reports being presented to the Detention Facilities Oversight Board represent a significant collaborative effort to ensure transparency, accountability, and continuous improvement within the system. These documents, we hope that they will provide a robust foundation for informed decision-making and oversight. So we look forward to, as the reports go through the process that the ordinance dictates, that these findings and further addressing any questions will be addressed at the appropriate time.
Thank you so very much. Board members, you have any questions? And so just all board members will receive the document prior to the February meeting. And so that we're clear about what that agenda will look like. Board members will receive the document. We will review the document at that meeting. The board member will vote on the document. Will we have public comment before the board vote?
According to the ordinance, ordinance number 71749, section 5E, for annual accountability report, the board reviews, and after the review and comment by the DFOB, we address it to the mayor, the board of aldermen, and chairperson of the Public Safety Committee, and present it at a public meeting.
Got you. Great. Understood. Understood.
Okay.
Okay. So because I just want board members to know, so that at the February meeting, we will be voting on, we'll hear the report, we'll be voting on the report, and then we'll move forward in that process leading up to public presentation. Okay. All right, I just wanted to make sure that everyone was clear about what the steps would be. Any questions from board members? Thank you very much. I've had an opportunity to meet with you. Very pleasant person. With roots in, yes, go ahead.
No, I'm saying thank you.
Oh, you're welcome. With roots in Jamaica, just so y'all know, you may have heard the accent. She has roots in Jamaica. Amen. I don't know if she's part of the Maroon tradition, but she'll tell me that later on. We'll try to figure that out. The next DFOB complaints and investigations.
We will be, Louisa, do you have information regarding that?
As it stands right now, Reverend Gray, we are compiling information. One of the things that you had mentioned about for us, we have the number of complaints, but one of the things you mentioned earlier in the meeting was about the dorm rep meetings. So we are in the process of making sure we can make sure that happens. We've been in communication with the Division of Corrections, and also sent out the letters that's required by the ordinance to the attorney. So hopefully by the next meeting, we will have an update on that whole process.
Ms. Louise, I've got a question. You just said something, and I want to be clear. And I've read the ordinance a couple of times, and I may have missed it. So are you saying tonight that the ordinance requires?
Oh, let me correct myself on that. No, the ordinance does not require that. That's one of the processes that we have used to do that, but we are in compliance with what we have been directed to do so far.
Okay.
So
no,
that may change. So let me say that may change, and if that's not something that we have to do in the future, then that would not be something on the list. But we have got an update of the names of the individuals who are dorm reps, and so we have reached out to find out when they're going to have another dorm rep meeting. So let me stand corrected on that.
No, I appreciate it, because as you know, we've always maintained that we're going to follow the ordinance, and so if it's in the ordinance, we don't want to do anything that is not part of the ordinance. But as I indicated, I will be communicating with the staff to ask them to, in writing, to try to seek a written policy that states that we are obligated to notify dorm reps to talk about general conditions. We're not asking dorm reps to talk about their cases. We're not trying to get into legal interference on any complaints. And we made it clear that our only purpose in talking to dorm reps is to try to ascertain general conditions within the CJC. And if there is a policy in writing that states, I know that it was mentioned by Acting Commissioner Ross, something as it relates to their constitutional rights. By all means, we don't want to do anything and would not do anything to violate anyone's constitutional rights. But if that information is written down somewhere, I think it would be beneficial for the board to see that particular policy, specifically as it pertains to requiring lawyers to give permission to detainees to meet with the oversight board. And so I just wanted to make, and I appreciate you clarifying that. I just wanted to make sure that all of us were on the same page with that, as far as understanding that requirement. So thank you very much, Ms. Louisa. Report on meetings and agreement with Commissioner Clemens Abdullah, the December 19th meeting.
Yes, we had a very good meeting with the commissioner and members of her staff on December the 19th. As a result of that meeting, there have been some very tangible outcomes. Our staff will be able to meet monthly with the CJC staff. And we also will be able, we have a contact person that has been designated at CJC for our staff to interface with. And that meeting, we will have a monthly meeting the third Thursday of each month with CJC staff. And the commissioner also agreed for our staff to have access to telephone and camera systems and information. So it was very productive, and it's just like the indicator from the presentations that we've heard earlier by Dr. Mati and Interim Commissioner Tammy. There are very positive developments that are going to be helpful as we seek to support the detainees and we seek to support accountability within the community and to be able to provide information. So that is happening. If you like, I can continue on with my report, Reverend Gray.
Yes, please. Yes, please.
We are looking into developing a dashboard for our website. The dashboard would be a tool to support building trust and contribute to accountability. It will provide real-time data access to the community. And we are examining and are in touch with the Chicago Civilian Police Oversight Board. That's not the exact name, but their function is similar to the function of our office. So we're very excited about this opportunity. And as a matter of fact, we just had a meeting earlier today with the IT staff for the city. And they know about our interest in providing the dashboard. And we were able to talk to them about some other matters as it relates to data, the compilation of data. So you'll be hearing more about the dashboard. You should have received by now my written monthly report. And on the written monthly report, you will see the various meetings that have been held. And we are also working on our 2026 budget. And I think, yes, you have my monthly report, and it goes into more detail about some of the activities that have been transpired in the past month. So you'll be receiving a written monthly report from me as we go forward.
Thank you very much. I think the only thing on the calendar of events that I would call into question, Madam Commissioner, is that December 11th staff holiday event where board members were not invited. But anyway,
we will make sure that won't happen again, okay?
I know Secretary Walker, like I said, we're very proud of the DFOB staff and the competency of the staff. I know that in the future, as you talk about your budget, I know it was mentioned previously for future board members, if there is an opportunity for board members, if there are meetings, oversight conferences, conventions, that kind of thing that occurs around the country, that if a board member or two had an opportunity to participate in that, it might be helpful for the board to see how other oversight boards and committees execute their duties. And so if that's something that you might consider in the 2026 budget, I'll throw that out there on behalf of all the board members who make it through January.
Well, Reverend Gray, we are already on it. There is a budget line item for conferences and meetings, and in the budget narrative, we are specifically identifying to include the board as well as members of the staff. So you'll be hearing more about that.
Barbara, you smiled. You can go too. You can. All right. Thank you so much. We know you've been busy ever since you've taken over this position, and we can see the fruits of your labor. So thank you very much. We can see it. I'm going to ask this question because Barbara, maybe you can answer, because we had public comments in the panel discussion. Do we still need to open this up for public comments again?
It is on the agenda. I mean, perhaps if someone has something that's unrelated that they want to state, I would suggest just seeing what's out there.
Again, we always want to make sure that we abide by the rules. Are there any public comments? Again, if there are, we would remind you that please put your hand up. I know Antoine will, he's monitoring it. If you have public comment from the public, if you'll put your hand up. And Barbara, I think they still have to state their name. We won't ask you for your address or anything, but please just state your name and make your comment, and you will have 3 minutes to make a public comment, your comment. Are there any? Okay, I see some hands up.
Me too.
Antoine, who was first? Who's on first? Let's go with the iPhone. I see the iPhone. So if you'll just take them off of mute, Antoine. You have to come. I think Miss Stacy's off of mute first, or Stacy rather. I'm sorry, Mr. Stacy.
Yeah, how y'all doing?
We're good.
Today the hard work y'all got. I know I only got 3 minutes, man. Only thing I want to do is give a small illustration, just to kind of even everything out. I ain't preparing no presentation. I was kind of just trying to listen to see how the board even works, to learn everything I need to learn. But it's a lot of things that people can't really address unless we've got people in there monitoring on the regular. I know it's designed just to investigate individual complaints. First, we got to let people know the board exists and give them a real way to make a complaint. Right now, as it stands, you ask the CO for an IR, you're going to be asking every CO on every shift for a week before they finally give you a piece of paper, and then they probably ain't going to turn it in. So it's not going to be any different with the board. If they put it on the tablets, you got about 60, 70 people in each pod. It's about 5 to 10 tablets that work in each pod. They fighting over them. So you put it on the tablets, and then expecting the staff to print that out, that's going to be another issue too. It's a bunch of other things I want to run through, but we'll probably do that as time goes. But I think another main important thing is this money that these private vendors is getting from our people in our communities. They making a lot of money selling this commissary and selling these phone minutes. They should be required to reinvest some of that back into reentry program, and all that. So she say it's already they already supposed to be doing that. I want to see the fund. How much money they making? Where is that fund? How do we know it's being allocated in the right way? People sitting there 23, 24 hours a day, ain't got no educational programs. That's not good for their mental health. They ain't got no access to religious services. You can't even get a Bible or a Quran in there, let alone somebody come in on Fridays or Sundays and, sit down and have a service. Everybody in there smoking deuce, because what else they got to do but sit around, or they want to talk about overdoses. That's the only way to make money in there right now. Ain't no occupational programs. I mean, a few people work in the kitchen, but I mean, it's a lot of revenue being generated. We can spread that around and make sure we're doing what's best for everybody and have some reentry services too that's following up with people. Ain't even no law library in there. How you ain't got a law library? You know, you gotta pay to use this tablet that people fighting for the chance to do that. And a whole lot of other things. I won't just run it all off, but I think it was important to just kind of give a little bit of an illustration just so we can see like it's a lot of barriers. It sounds good when they're giving these presentations, and I know everybody got good intentions, but we got to, everybody got to meet in the middle and see how we're gonna make it work.
Stacy, let's do this too. I think that Acting Commissioner Ross has indicated she's left her number and her email address. I'll put mine in the chat. I think that for us as an oversight board, to be honest, there are some restrictions for us, but you as a private citizen, there are some things that you can do that we can't do. But I think we'd be more than happy through our commissioner with DFOB or through one of our board members to put you in touch with Deputy Commissioner Ross to do a sit down, to do a face-to-face sit down and share that. But the other thing, I tell you, there is a report that is being done right now. The person that's doing it is Doug Burrows. And Doug was responsible for a lot of the work, a lot of the programming in the county. I am going to put my number in the chat. If you will call me, I'm going to connect you with Doug so that the same things that you just mentioned and observed, you can share those with Doug in hopes that they will get in his final report to the administration. And so I'm putting my number in. It's a public number. Everybody got it, so I'm not worried about it. But if you give me a call or send me a text, I will put you in touch with Doug Burrows. And I think that Doug at this point would probably be the absolute best person to talk to because he is putting this report together. And so if you're open to that, my number's in the chat. Please feel free to use it. I think the iPhone, the young lady has her hand up. Please go ahead, Answer if you'll take her off of mute. And then Ms. Webb will be the last one. Go ahead.
Can you hear me?
Yes, ma'am.
I'd like to introduce myself. I'm Minister Teresa Waller, and I just wanted to thank you all for being able to come into such a meeting on this evening. It was a friend of mine had sent me the text regarding the meeting, so I was all prepared to be downtown. And then she said you all changed it because of the blues. But I wanted to commend you all. I felt honored to be a listening. I am the mother of Isaiah Bernard Burns. And I'm going to try to say this without crying because I have not seen my son since February of last year. God blessed me to see him on the very last day of this year, 2024, that just passed. And then I was able to see him again on Tuesday of last week. On this evening's visit, I'm going to pursue to go down every Tuesday at 3:30. I thought that would help him remember, even if he has access to the days of the week. But right now, my greatest concern is I'm not being able to advocate for him. Isaiah, upon arrest, it was very apparent he was mentally ill, and he has been. And so my voice of opinion from the very beginning, going down to the bonds hearing courts and everything, has been for his mental health. I'm not concerned about anything right now other than his mental health. He was diagnosed bipolar ADHD from kindergarten to high school. And I was the one that was out there protesting on last Sunday. I'm very concerned right now. It was apparent that I could see that he had IV marks in his arm. He's nonverbal. And when he expressed himself, he did express himself, God blessed his mind, on Tuesday to say, they should not be cussing me. And I agreed. I told him, I said, that is true. And then he also said, they shouldn't be trying to make me out to be the bad guy because I'm not. And I said, no, you're not. And so I've just been standing as a mother since 2022. I didn't know how the process worked. They deemed him mentally incompetent from the public defender, Andrew Cook's voice to me in court that day in April. They would move him in 2 weeks. He's still there at the Justice Center. And I have to say, honestly, I'm very displeased of not being able to advocate for him because he cannot advocate for himself. So I thank you all for this opportunity and this platform. I will be continuing to do what I can do. I'm limited right now because it seems like that Judge Kalia Stovall Reed would not allow me to put anything in place to be his POA. And I was his, his power of attorney. He was on disability way back from years ago when he was in school up to the time he graduated from Rockwood Summit at 18 years old. So I am that mother that is very, very concerned about her son's well-being and his mental health care. My goal is to see him move to the hospital as it was told to me so he can continue in a safe environment, healthy environment with the professionals that are able to tend to him. And on this evening, she came back down and she said, nobody can do anything with him this evening. So I don't know. He was calm on last week and then on December 31st, but he's afraid. It's fear in his eyes right now. And I'm very, very concerned about that. So on tonight, all I could do was just leave. 3:30 next Tuesday, I'll be there again. And Mr. Barnes, we're going to continue to just, I come every week. I only get one visit a week. So I'm thankful for you all.
Well, thank you. Thank you. And our heart goes out to you. And we're here to do as an oversight board whatever we can. If you have any pressing concerns and maybe need some direction, I would suggest, give the DFOB staff a call. There are some things they can do. There's some things that they cannot do. One of the things they may be able to do, if it's not a complaint, they may be able to refer you to someone. And Acting Commissioner Ross did indicate, I think she left her number.
Yes.
I would say avail yourself to that. If she left you the number in public, we're all here. Please give her a call and follow up. As I said, the DFOB staff is limited also to what they can do, but they may be able to refer you to some organization. And I know Mother Jamala is on here. Organization of Black Struggles, OBS. There are a lot of different organizations. Whatever we can do within the preview of of the ordinance, we will do. And what we can't do, we believe, Minister, we believe in the ministry of referral. And so that's what we'll do. So thank you very much for your comment tonight. We've got one more. Ms. Webb is the last comment, and then we'll go to new business if there is any. Ms. Webb?
Yes. Can you hear me?
Yes, we can.
Okay. One thing I want to do, I want to apologize because it's very frustrating and some of my comments might not have come off quite nice.
No need to apologize.
You know me, Mr. Gray, you know me.
Yes,
but it is very frustrating, and this whole thing has been a nightmare, I'm sure, for everybody, you guys too. I do appreciate you guys, all of you. But I do agree 100% with Stacy, with everything he said. All the stuff that happened to my son, I'm just wondering if because it's been over years, this has happened not once, but it's continual. And I just wondered, are you guys doing anything to get like videos or audio or records or anything in the meantime until you're able to start pursuing the complaints? And another thing, the board is not allowed to see complaints, or you just haven't seen them yet?
I'll let Louisa answer, either Commissioner or Louisa, if you'll please respond to Ms. Webb.
As far as the complaints go, there is a procedure for as far as the training goes, that there's certain things that need to be completed, and that is in the process of completion. We will be providing those complaints to the board, so the board will be able to see those complaints, as well as when we do our investigative reports or overview of what's going on, they'll have an opportunity to comment on the various things that's occurring.
Does Mr. Burris get to see any of the complaints? Because wouldn't that be beneficial to him?
Say that again, Ms. Webb.
Mr. Burris, wouldn't it be beneficial for him to see the complaints also?
I don't know, because I don't know the extent of Doug's mandate yet. I know that he was given 45 hours to complete his analysis. I know that he's done over 100. And so he's gone above what he's been paid to do. But I'm in communication with him. I don't have a problem, Ms. Webb, asking him what the extent of his investigation, or I don't want to use the word investigation, what the extent of his analysis or review is. I will ask him that question. And you already know, you know how to contact me, but I'll ask him that and find out just how extensive that review is. And then I can speak to you offline.
Okay, if he would talk to me, I would like for you to give him my information.
Okay. I will ask him that. And if he says yes, with your permission, I'll do that. But I'll ask him because again, I'm not clear what the parameters of it is, but
right.
I will commit to at least asking him.
Thank you. Thank you. I appreciate it.
You're welcome. Any other comments? Any other public comments? I wanted, Barbara, before we go to new business, for the February meeting, are we required to have public comments?
No, that's just something that has been on the agenda. And it also doesn't have to be a question and answer period. It could simply be a comment, somebody making a comment.
Okay. Thank you very much. Any new business to come before the board? Board members, any new business? All right. Seeing none, let's schedule our next meeting. We're looking at which
Reverend
Tuesday?
Gray?
Yes.
Sorry to interrupt you. If
That's
I
okay.
may, I was remiss in making one point. I just want to acknowledge that Director Coyle has been meeting with me on a regular basis, and he is also providing a lot of support to address some of the concerns that we've had. So we really do appreciate his assistance.
Yes, ma'am. And before we schedule that next meeting, because I don't want to get in trouble with board member Gay, because I know he's going to say, wait a minute, Reverend Gray missed something tonight. He missed something. We need to approve the minutes from the last meeting. I was so excited about our panelists that I forgot and I know Mr. Gay, he'll knock on the door and say, come on, Reverend Gray, get with the program. Can we get a motion to approve the December 17th, 2024 meeting minutes? Is there a motion?
Motion to approve.
It's been properly moved by the proper person, board member Gay. Is there a seconder?
I'll second it.
Seconded by Secretary Walker. All in favor, please raise your hand. All opposed, raise your hand. Motion carries. I saw everybody, Barbara. Did you see everybody?
No, yeah, I think I did.
I know you were looking, so was I. All right, motion is approved. Our minutes are approved. I don't have my calendar. Is this the second Tuesday or the third? What Tuesday is this? What
Second
Tuesday?
Tuesday.
All right, so do we want to do second Tuesday in February? Does that work for everyone? Is there any objection to the second Tuesday in February for our next meeting? Nobody's saying no. No thumbs down. I see Pam gave a thumb up, so as long as Pam's here, we can do it. All right, so we'll schedule our next meeting for February the 2nd Tuesday. What day is that?
That's the 11th.
February the 11th at 5 p.m. And we will confer with our commissioner regarding the agenda. Board members, if you have any items that you want on the agenda, you can always reach out to me or reach out to the commissioner so that we can go ahead and put that on the agenda. I want to just make sure I'm looking. We want to thank everybody for, I think, a wonderful meeting tonight. We expected 2 hours, 2.5 because of the panelists. We got within that 2.5 period. So I think we did good. Thanks to the leadership of our commissioner who continues to keep me focused. All right. Is there a motion to adjourn? It has been moved, I think, by board member Gay that we adjourn because See, he's not on mute. There's
Motion to
thumbs up.
adjourn.
And that there is a second by Board Member Harper because she's on mute.
Yes.
All in favor say aye. Aye.
Aye.
Aye.
Anybody that wants to stay on, say nay. Okay. Thank you all very, very much. It was a great meeting tonight. Thank you all. Commissioner,
Night,
I'll give you a call
everybody.
tomorrow.
Thanks.
Good night, everybody. Be safe. Y'all be safe.